Hello, my support fibro friends. Hello, hello. Come on in. If you're watching live and I catch you, please leave an emoji, say hello, let us know where you're tuning in from. This is an impromptu live stream from Support Fibromyalgia Network. I know Brandy and I are going to be out for 3 weeks doing our regular live on Friday. But we are going to do a live together from Houston when we connect. So we are getting ready for our trip and we're on our way going to be on our way shortly to Houston. So there's a lot of things coming up. And that's why I just wanted to share with you a little bit more about what is happening so far this month and into October and some of the things for November. There's a lot on our plate. So I just want to make sure that you don't miss all the opportunities to join us, all the resources and things that are happening. Patient education will continue. And we'll continue to share as much as possible. So come on in here. I'm going to have different variety of share. I'm going to try to share my screen as well. I am Melissa Talwar. I am the executive director of the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. I'm excited for what's ahead as we have a conference coming up with the Texas Center for Lifestyle Medicine. This was built off of training more providers. We've talked about Project Echo a lot. It is still on the table. It is still my dream to democratize fibromyalgia knowledge so that it's accessible to all healthcare professionals that would like to join and be trained, especially our primary care physicians. I still have that on the table to launch and get launched. And so I know we have that in the works for Project Echo. What we need is we need more healthcare providers willing to spend time teaching other healthcare providers. So I don't have an MD. I wish I did. I am working on a clinical degree potentially, hopefully crossing fingers, which I'll get to at the end so soon. But I can't finish the requirements for CME credits that we would need for Echo. Now we can train other healthcare providers also. So if there's nurses and NPs, nurse practitioners, if you want to come in, even PAs, we can even start in different realms. Definitely welcome it. But this goal is big. I would love to see personal goal for the nonprofit organization is to have at least one healthcare professional trained in each state that takes insurance that is certified in fibromyalgia training. So this is the beginning of something new, and we're excited to be partnering with the Texas Center for Lifestyle Medicine when it comes to effectively putting together some training for fibromyalgia healthcare professionals. So this is where the conversation began. And I know Texas Center for Lifestyle Medicine, for those of you who are in Texas that would love to join a virtual group, they do take insurance. They are providing integrative and functional medicine there at the clinic that helps a different variety of conditions, not just fibromyalgia, autoimmune conditions. They have a cancer group, a diabetes group. They do take insurance at their clinic. So just to let you know, they do try to do their best to minimize the cost of the out-of-pocket things that they might share with you. So you can get the provider treatment covered by insurance, which is huge. They are currently running a fibromyalgia virtual collaborative care group. It is led by Dr. Ron himself, which is pretty incredible because many of us feel like we don't have enough time when we're talking to providers. So Dr. Ron himself, who is trained MD in integrative medicine as well, is in and leading the actual group with the patients, which again is pretty incredible to get his time for the length of the group. It goes from 45 minutes to an hour. And I've seen him stay even longer in some of the groups. So that's pretty incredible in itself. And again, billable to insurance. We'll ask them more questions on that as well. No audio. Oh no. So I've just been talking. Thank you, Judy, for telling me. So I've been talking with no audio. So let's see if we. Ooh, okay. Judy, can you hear me now? I'll have to edit this out. Okay, so hopefully you can hear me. I don't want to put too much feedback here, but I changed the settings. So if everybody can hear me, we'll start over again just to see and see if we can get in here. So where the data source is. Hopefully you can hear me now. Otherwise, I've just been talking for no reason. So that's a bummer. So let me start again. Oh, someone said I had audio the whole time. Oh, yeah. Okay. So I'm confused. So when I don't have Brandy on with me, I get even more confused. Okay. So I appreciate someone counting in. So let's get to it instead of having me ramble. So some of the stuff that's coming up. So Brandy and I are both headed to Houston shortly for the October conference. I'll be leaving on Sunday to start my journey in. Brandy's going to start from South Carolina as well. So this is what we are actually working on. And there is an opening for the general public to view. So this is the conference. It's a collaborative multidisciplinary healthcare symposium organized, and Dr. Ron has put together a lot of providers and having them come together. And it's definitely geared for more of the training. This was the idea around it. So training other healthcare professionals with fibromyalgia. You're going to hear a lot of different information that we haven't heard before. He's bringing in well-renowned dentists. So we're going to talk about airway pathways. We're going to talk about dental health, oral health, TMJ. And I know we've shared some of his videos too that reflect on the fact that if you're having dental issues, this is going to affect your airways at night when you sleep, which is the connection too we can have with unrefreshed sleep. So there's a lot of layers to this. So he's organized an incredible amount of speakers, a variety of people. I'm very eager and excited. I'm probably going to fangirl out at meeting Dr. Simmons, who is a certified neurologist, and he's a leading authority in sleep medicine. He is based in Houston, so I'm excited. And there's some other dental providers too. And just a variety of speakers from chiropractic health to ENTs. Again, we're talking about these pathways in like nasal structures, airways, anything that relates with that, because we really want to get involved with sleep. What is happening with this unrefreshed sleep? And this is diving into so many details. And then when you hear Dr. Ron talk about myofascial pain, going to dive into that too. There's going to be some providers that talk myofascial experts for releasing that connection. If you have a lot of that upper body, shoulders, pain, tightness, all of this, you have your shoulders up high. This is all playing a role. So this content going to be presented. I haven't really seen it presented in this type of platform before, which is why I'm excited to actually be on site in Houston, talking to the providers and getting to know them. So again, just difference of providers coming in. We have an endocrinologist who will be speaking as well, which will be cool, talking about hormone health, more of an integrative approach to hormone health. And this is important. This is an important piece for fibromyalgia. And we don't get into the science as much as we need to when it comes to even HPA axis. We think thyroid only, but there's so many precursors involved. There's a lot of estrogen issues involved with this, especially just in general women's health too, which comes up. So I'm excited to see these speakers live. And that's why I just wanted to share with you the different tracks that you can join. If you are in Houston, please let us know. I would love for you to join us in person if you are in Houston. And I'm scrolling through really fast, but you can find this information at the following link. So I'm going to put that in the chat for everybody. And if you would love to join us, that'd be awesome. So if you are in Houston or know people in Houston, come on down. We would love to meet you. Brandy and I would love to meet you. Plus, I would love to connect you to the Texas Center for Lifestyle Medicine and meeting their team. Again, it's a wealth of knowledge of integrative medicine in the Houston area. So for anybody that might have things happening in different health forms, autoimmune, dysautonomia, other conditions, diabetes management, and things like that, you can have a primary, you can keep your primary doctor and then go and visit the Texas Center for Lifestyle Medicine. They have a lot of information there to share. If you keep scrolling down, you're going to see the different ticket prices. So there's a donation for live stream attendance, which is made for general public. So the live stream will take place in Central Time. There is a $10 donation to PTI. So that is the Physicians Transformation Institute. It is a nonprofit organization built for training healthcare providers and doing workshops and preventing provider burnout. I need to get their mission staying completely correct, but you can learn more about that organization there. So they want to create more programs like this for training fibromyalgia, like not only having more patient-directed programs, but also education to providers, because it's huge to have other providers talk and train other providers. That's what we need, right? So we can only do so much as patients when we go into the doctor's office and we have information to share. The providers will have to go out on their own to learn. So it closes this gap if we have experienced medical providers that can train other medical providers or have a resource hub that they can actually go to ask more questions. So that's the essence of ECHO and what we want to do through case-based learning. That's a part of it. So we would have a database that's up to date of providers that have actually been trained in fundamental knowledge for fibromyalgia, and then also this advanced knowledge. So if you've gone through a program like with the PTI, Physicians Transformation Institute, with Dr. Ron, that would be listed in the database as well. So there's a lot of certifications to try to get providers as much information as they can with training, advanced training, and then also giving them a community of support. So for PTI members, if you do have someone that is a health professional, by the way, this can be MD, DOs, PAs, NPs, NDs. I know NDs have different scope of practices per different states, so this can vary. Acupuncturists, health coaches. There is the ticket for PTI members. So this is a yearly ticket, and you will get the free access to the fibromyalgia conference and information as part of your yearly membership. I became a member. So a lot of the courses are managing clinical private practice information. Dr. Ron has information on ChatGPT, updating different ways to add health coaches, group health coaching information, and you can network with other providers in a system. So that's what that PTI members virtual ticket means. I know some people have asked. There's also ways when you sign up for membership to get more CME training. So he's built out that portal. So that's a lot of people were asking questions. So the conference does come free with that membership. If you are interested or know someone that may be interested with that background, we really definitely include them in that. For the general public with the stream, it's a $10 donation to PTI. It is the live stream only part, and it is in Central Time. So keep that in mind as far as attendance goes. Then the virtual tickets, if you want the actual content, is a different price than in person. For medical training is a different price listed as well. But I wanted to take you through. So the conference itinerary has been posted. So feel free to scroll through it again, especially if you're signing up for the live stream ticket. Ask questions. Definitely don't hesitate to reach out if you do have questions about this particular conference. I definitely want to get the information and content to anybody that's interested in doing it. We will be on site, so please feel free to ask any questions. We will try to do our best to stream like personally. We won't be able to stream the content necessarily because I know we're helping and working at the same time, and we'll be assisting them with their live stream. But we will do best to maybe do some interviews or invite some of these providers to the conference that we are holding. Yes, just to let everybody know, there is a fibromyalgia community conference. It's going to be later this year. It'll be after Thanksgiving, I think, after Giving Tuesday. So that Thursday through the first week of December, we're going to extend it to add more content, not stuff it only in a couple of days of 24/7 streaming, because that was a lot and not everybody can attend. But it's going to be available to everybody out there. So we would love feedback as well. Another thing that I wanted to share with everyone for updates was that Swing Care, another company and organization we work with, has launched Swing Care in Tennessee. So residents that are covered, and it says by United and Medicare, you can gain access to Swing Care. So that is huge news for Tennessee. They are currently launched in Texas as well. There's a lot of great things happening in Texas. So that's phenomenal. If you are looking for fibromyalgia care services, healthcare services, I know many of us search for doctors and providers, this is another great resource to take a look at, especially, and they'll be expanding. They have some extra news too. They'll expanding in another state middle of October, which we're excited about. So Texas, Tennessee, and another surprise state, which I won't reveal until I've been given permission, but I'm excited about it too. We know we have some friends in that state, so looking forward to that. So if you are looking for extra care and providers, it is happening. We want it to happen faster. Trust me, I want it to happen so much faster to find providers in every state for you that it's covered by insurance or at least understands fibromyalgia enough where you can get good quality care. That's a goal. It's coming. I'm carrying a lot of hope for all of you that it will come sooner than later. So Swing Care is another resource to check out. We also, as an update for the organization, we have a fundraiser going on. We have a few more weeks left. If anybody gardens or has friends that garden, these make great gifts. And donations are great and stuff. So you can see what they have here. They have tulips, alliums, all kinds of bulbs. They have mixed. So if you like to plant flowers in your garden, it's a fantastic resource to get. And also we'll have a Seas Candy fundraiser up and running as well. We appreciate the donations. Please definitely know we are a national nonprofit organization, really digging in and doing a lot of work to try to make a difference for the fibromyalgia community. So this helps and goes a long way. I did buy the sprout collection just to let people know with growing broccoli sprouts and stuff like that, that I can actually eat. So I'm giving that a try. So it's all kind of coming together as we need it to, but I appreciate all of you. Thank you for allowing me to do an impromptu live. And again, just to let people know, we also have a navigating fibromyalgia, like navigating school with fibromyalgia workshop coming up next Wednesday with Brandy. It's a free workshop through Zoom. I will post the link in the discussion and in the chat so you can find it. Free to register. Brandy will be leading that for families that need that extra support right now with school, having kids in school. So that's happening next week, Wednesday at 1 p.m. Eastern time. We hope you will register if you're interested. We've been getting feedback on other workshops that we should have, which is fantastic. Keep them coming, because we did get feedback that someone would like to see a workshop about managing work from home or just work life. We definitely have some speakers that we're going to include in the Fibromyalgia Community Conference in November. We can do live stream discussions with Brandy and I on those topics as well, but we love it. Keep sharing topics that you want us to share with the community, and we'll happily do it. So much is coming down the pipeline too. So again, there will be a Fibromyalgia Community Conference. We're going to be reaching out to some speakers. It's going to be spread out a little bit. It will be free. Live, we're going to have some streaming live integration, but here's the question for you. If we had speakers come in and share more about them and the topics of conversation, but they also host a workshop in Zoom, is it something that you would join separately? So it would kind of like, for example, we would have a speaker that's, maybe they're talking about work life or work from home life. So they would come on, we would do maybe a live stream with them and asking them questions and stuff like that. But then you would move into a workshop setting where it wouldn't be recorded, it wouldn't be live stream, but you can actually have more of a hands-on workshop. So these are the kind of integrations we're thinking about for the end of the year for the conference, but the conference will still take place. We just need a little bit more time. Because of this conference in Houston, we are also going to be attending the American College of Rheumatology in November. And I know Brandy is taking her master's program to become a board certified health coach next year. That is already started for her. And then I am busy studying. I think, as I revealed to many of you, I am trying to go more into clinical care. I've been loving group medical visits, but I'm still noticing that there's a gap with healthcare providers. And one day, I hopefully, if it aligns correctly and my body works, I'd love to be a part of the clinical setting to actually have my own private practice, hopefully as an NP, and do that, I think, in the states that allow me to do that without supervision. But I'm currently trying to finish my prerequisites, which I don't know if I'll actually make the deadline. So if you've been reaching out, I've been trying to get everything coordinated, but I'm very busy behind the scenes studying microbiology, anatomy, physiology too. I have to do statistics, psychology. I have to make up some prerequisites, even though my degree was in biology and I was pre-med. So there's a lot going on behind the scenes. Please do follow us. Let us know what kind of content you're interested in, and we will be happy to share. So stay tuned for updates as we hit the road. Headed to Houston. Join us for the live stream of the conference if you can. And again, just tune in to our education series. Take a moment to connect with Brandy on Wednesday if you want to connect with other families. We have some great support system, and join us on Inspire. So thank you, everybody. Hope the audio worked out in the end. I appreciate you. It's good to see everybody here. Thank you, and we'll talk soon. Bye.